wake of the announcement of Nigeria's first coronavirus case, the prices of hand sanitizers, gloves, and face masks have hit the roof. In more extreme cases that have been reported, these short-term interventions against the spreading virus are completely off the shelves in most parts of Nigeria's urban centers. How would this impact the immediate and long-term collective effort to stave off the dangers associated with direct contact with surfaces, which has been identified as the surest possible way of contacting the disease? We'll now discuss this with Jona Okotie, a pharmacist and secretary of Association of Community Pharmacists of Nigeria. We'll also be talking about drug distribution policy, health insurance schemes, and the required collaboration of medical professionals in this time of great need, as well as the appointment of the board of the Pharmacists Council of Nigeria. Good morning. Welcome to the show.
Good morning.
Good morning, Jona. Good to have you on the program.
Thank you.
Sorry, we no longer shake hands.
No.
When you came into the studio, I said it was not possible to shake your hand.
Everybody keep your hands to yourself.
Yes, keep your hands to yourself.
These days we do leg shake,
Leg
right?
shaking, yes, and elbow.
Smile and wave.
Yeah, but see, I mean, one should be surprised, or maybe not, that in Nigeria now sanitizers have become very expensive. Like this is alcohol-based, hand wash. Yeah, and then do we have enough masks? How do we address this? Because all of a sudden, between February 27th and now, what we hear is that face masks are in short supply. What should government do? If people need these masks, where can they get them if they're still available anywhere on the shelves?
Well, for starters, I will say maybe our response was slow as a country.
To coronavirus?
To the stocking of this or to the availability of this product. Because when the issue of coronavirus started sometime in December and up to when it became like a global issue in January, by then, feelers were beginning to come out that some of this, particularly nose mask or face masks, were being shipped out in large quantities back to China because it's like they couldn't meet, because of their own the outbreak over there, they had need for more of these products. So they started sourcing globally. I expected that at that point, the agencies of government should have kind of put a lien or create awareness in the sector to say, guys, as much as you want to make profit, let us also realize this is going to come upon us at some point in time. Today, it has come upon us. The quantity of products available is, from what we know from economics, demand and supply, is what has come upon us now. So the price has hit the roof because the quantity available is not so much compared to what it used to be.
That is extremely disappointing that we had to be so reactive. But my question for you is, as a pharmacist, what's your response to the Federal Competition and Consumer Protection Commission and their press release? Have you seen it? Explaining to the public that it is criminal and predatory to hike up the prices of hand sanitizers, especially when hand sanitizers, your face mask or your disposable gloves could be the difference between life and death, to take advantage of the prevailing fear, the prevailing panic, and make consumers pay 10 times more than the value. What is your response to that?
It is, on the issue of the panic, I think we are in a panic mode, so that is not really guiding a proper response to the issue. It's not everybody that needs nose mask. Yeah. This morning, as I was coming in, I read on the news the Surgeon General in the U.S. gave a directive that people should stop asking for nose mask. The people who really need nose masks are the sick.
The people with the coughs.
The people with the coughs, the medical personnel. Those are the people who critically need nose masks. Walking around the street with a nose mask will not necessarily protect you from anything.
Because a lot of the nose masks have like a gap on the sides anyway.
Exactly. So it's I would say, using an unnecessary product as it is right now. Then coming to the issue of the scarcity, the DG, FCC, PC cannot tell people, oh, it's crazy to sell nose masks at that astronomical rate, when as at today, from the suppliers. As of yesterday, the price of a pack of nose masks containing 50 pieces is going for like 8,000 naira.
8,000?
Yes. So if I buy a product for 8,000 naira, how much do you want me to sell it?
It used to be less than 3,000 naira.
It used to be 350 naira.
Each?
Yeah.
Yes.
So a product that used to be 350 naira is now going for about 8,000 naira.
Oh, so you're saying 8,000 naira each?
Yes.
For a pack of 50,
for a pack
you said?
of 50s. So if I buy a product for 8,000 naira, how much do you expect me to sell? So coming out to say pharmacists are trying to be dubious, for me, is being economical with the truth. Because one, we don't even have facilities to produce any of these things.
But isn't this stock that the pharmacies already had, that they spiked up the price to get rid of, rather than pharmacies having to call in more supply? Wasn't the entire idea that pharmacies couldn't access more supply, this is what they had, and this is what they were trying to get rid of, and they were taking advantage? And I say that because it's not just with this situation that you see pharmacies do it. For example, look at the way pharmacies spike up the price of sanitary products for women, just because they know that women are still going to need those products every single month and they can take advantage.
I'll call that speculation. Because two things. One, from the economic side, if I buy a product 350 naira, and today that product sells for 8,000 naira, by the time I sell my product for the 350, or let me say 400, 500 naira, by the time I'm going to the market, I'm going to buy that product at 8,000 naira. So how will I be able to replace the product I've sold? You have to look at it from that economic side. Then secondly, for us, our profession we have a moral obligation. We swear an oath to make sure whatever we do, we consider the lives of the people concerned. So looking at it from that point of view, I don't think any properly trained pharmacist who knows his or her onions would jack up the price of any product because he or she wants to make profit. That would be irresponsible. So from the FCPC's DG's point of view, we have some serious concerns. Because going out to say blanket that, oh, people are increasing prices arbitrarily is how will I put it, is assassinating our own character. And I don't think that will portend good for the interest of every Nigerian. The average pharmacist who is practicing in Nigeria is sacrificing so much to remain in this environment because the environment is not friendly for our practice. It takes you so much to set up.
The environment is not friendly for anybody.
Anybody's practice.
Well, for anybody, agreed. But for us, we used to say this, that we are over-regulated. But it's okay because of the nature of the products we are dealing with and because we are dealing with lives, we have to be regulated. That's fine. To put in place those measures to meet up with the regulatory requirements is huge. The government is not providing any kind of support to... We don't have intervention funds. Like today, they have intervention funds for agric. They have intervention funds for some other sectors. But for the pharmacy practice space, particularly the community pharmacy space, we don't have any kind of intervention fund. So you have to source the funds for yourself. And that is besides the security issues, the lightning issues, and expiry.
No,
I'll give you an instance.
Refer to government. I mean, government, has regulation in place to prevent quack pharmacists from operating. You have the Nigerian Drug Law Enforcement Agency. You have the licensing process for, what do they call them, patent medicine stores, and all these chemists to protect the professionalism of those of you who are community pharmacists and who are trained. So let's be fair to government. All of that are in place, and government enforces those rules and regulations.
I'll say supposed to be in place. That's, you are talking about the
rules and regulations are in place.
The rules and regulations are in place, but the question is, what is the regulatory and monitoring activities going on in our space? I'm almost sure you walk around the streets around you here, you will see maybe a kiosk or some other person who is peddling drugs. And that brings us to the issue of drug distribution, which is why we have this problem. I think sometime in 2014, the government was supposed to implement one of these policies you talked about, if the National Drug Distribution Policy had been in place, I'm not sure we'll be here. We'll be speaking this grammar that we are talking about now, because there will have been monitoring and control right from when the products come in, the manufacturers, the importers, the distributors, and even to the retailers. So there will have been a measure of price control. But right now, the people who are in the pharmaceutical space, fine, it's business, but then there's no control. Anybody can come from anywhere, distribute whatever they like. Yes, there's supposed to be regulation, but then the regulation is not being followed or implemented.
Anyway, let's go back to coronavirus.
Yeah.
No vaccine has been found yet.
Yeah.
The Israelis say they are close to it. But what we hear is that it will take up to 3 months. Some other people say they are trying some other drugs, but we don't know yet. Are we in trouble, really, with coronavirus? Because if there is no drug, if there is no vaccine, then of course it means the numbers will keep going up. Do you see any hope ahead with this latest epidemic?
This is not the first time we're having an epidemic. And for me, like every challenge, the human being has a way of finding a means to solving its problems. Ebola was upon us. The world didn't expect that Nigeria would do what they did. To be fair to the health bodies in this country, particularly Lagos State, there is some measure of organization and structure that is in place. That's why, to an extent, you could see that the man was taken somewhere. Fine, they might say there's a problem with the facility there, but there's a place that was designated to handle such a thing. So I would say give it to us on that account. Should we improve on it? Definitely. For when they say to take 3 months, I don't know about what the Israelis are saying, because for the average, for a new drug to come out, the minimum it will take you will be like 18 months. Yeah. The minimum it will take you.
But then I hope the world will still be in place.
No, the world will be in place. But then the basic tenets of hygiene, wash your hands, you see someone who is sick, keep your distance, will go a long way to protect us rather than looking for the wonder drug. If we do the basic hygiene, go back to the plague of England in, I think, the 16th, 17th.
Bubonic plague.
Yes, bubonic plague.